Hi, Oyen. My name is Mary Catherine. I'm a physiotherapist and I'll be working with you today.
Hi, Mary Catherine.
I see that you are here for shoulder pain.
Yes, I hurt my shoulder playing tennis about 2 weeks ago.
About 2 weeks ago?
Yes.
Okay. Have you ever been to physiotherapy before?
No, this would be my first time.
Okay, so I'm going to explain a little bit about what we're going to do today.
Okay.
So in this shoulder assessment, I'm going to watch you move. I'm going to have you lift your arm up in different positions, and I'm going to test some of the strength of the muscles in the shoulder. The shoulder is very much influenced by what you're doing in your upper back and your neck and how well you're moving in your arm as well. So I'm going to watch all those other body parts move as well to see if they're contributing to some of what's going on in your shoulder. Sometimes because we're trying to see what's going on and bring on some of your symptoms, you can feel a bit irritated or aggravated after an assessment. And so what I would do is give you some options for treatment and hopefully help you to feel better. But it is a risk of doing the assessment that you can feel a little bit aggravated from your pain after the assessment.
For how long?
The discomfort should never last longer than about 24 hours after the assessment.
Okay.
Yeah, we'll be careful for sure.
Okay.
Of course, the benefit would be that we would be able to figure out what tissue or what injury is going on and provide you with a tailored treatment plan so that you can get back to playing your tennis.
Okay.
Do you have any questions for me?
No, not at the moment.
Okay, so during the assessment, it is helpful for me to be able to see your shoulder and watch how your shoulder blade, for example, is moving on your upper back. Would you be comfortable either putting a tank top on, or I also have a gown for you to wear?
Both are fine with me.
Okay, great. So let me go get that and we can get started.
Okay.
So Oyen, we've done the movement portion of the assessment, and one of the things I've noticed is that your shoulder is sitting a little bit forward. One of the contributing factors of that could be a tight pectoral muscle.
Okay.
The pectoral muscle is the muscle that crosses the chest, and it starts from the inside of the bone of the chest and goes all the way across and inserts into the arm.
Okay.
What I'd like to do is put some pressure through it or palpate it or touch it to see how much tension is there and potentially treat some of that tension by doing some gentle massage.
Is it going to be painful?
I won't put a lot of pressure if it's painful, and of course you can always tell me how much pressure feels comfortable.
Okay.
It is very close to the breast tissue. The breast tissue and the pectoral muscle overlap, so I won't be going directly on your breast, but sometimes some of the massage could touch into the breast tissue.
Okay.
Is that something that you would like to do today?
That's fine.
Okay, of course you can always say no, or we can stop it at any time and then continue with just other treatment like exercise and other stretching.
Okay.
Okay, let's get started. Hi Oyen, how's your shoulder today?
It's still pretty sore. It hurts to move my arm. Is there anything else we could try?
Yeah, one of the things that we haven't yet tried is acupuncture. Is that something that you might be interested in hearing about?
I think so.
Okay, so I see that you have signed the consent form, but let's go over a little bit some of the details around acupuncture so you have an understanding about what it is.
Okay.
Acupuncture involves inserting very thin needles into the tissues around the shoulder, and it can be helpful for reducing tension in the shoulder, reducing some inflammation that's there, and can really bring help people kind of move to the next level when they've been having pain for a while.
Okay.
Of course, it doesn't help everybody, but I've had a lot of patients that it has helped. There are some risks associated with acupuncture. Some people feel dizzy because of needles, so we'll make sure that you're lying down when we do the acupuncture. And there's also slight risks of infection or irritating a nerve, so I'm going to be careful about where I'm inserting those needles. We're only probably put 2 or 3 needles in today because it is the first time, and you can of course stop at any time if you're feeling uncomfortable or you're not enjoying the session. The alternatives to doing acupuncture today is that we could continue to do some of the manual therapy work that we've been doing, and we will continue to progress your exercises. Do you have any questions for me at this point?
Yes, you mentioned soreness. How long would that last?
Generally, the soreness doesn't last for more than a couple of hours after the acupuncture needle's been in.
Okay.
We would only insert 2 or 3 today as it is your first time, so to make sure that it feels okay and that it's something that could be helping.
Okay.
Is that something that you're interested in trying
That's
today?
okay. Yes.
Okay, so we'll get started. Ask me any questions along the way, and at any point if you decide you don't want to continue, we can stop the treatment at that time.
Okay.